Houston since I was a little kid, 10 years old, and just love being here.
Complicated question there. I'm from Chicago, Chile, California, Texas.
I'm originally from Kenya, actually born in Nairobi, Kenya, and grew up in Atlanta.
I am a Texas transplant. I'm from upstate New York originally, outside Albany, and really did all my schooling and training up in the Northeast and Midwest and came down to Baylor 5 years ago.
I'm Armenian originally, but I've been in Texas for a while.
I am originally from Columbus, Ohio. I went to medical school at Vanderbilt, and then I did residency and a chief year at University of Michigan.
I'm from India and I trained my pulmonary medicine at New York, and I joined here for the last 6 years.
I'm from California, I was born there, but I went to undergrad and medical school in Texas, so I'm probably more Texan than anything else. Went to residency at the University of Chicago, did some global health work afterwards, and then came back down to Baylor to work.
So I am a native Houstonian. I left for most of my medical training, but then came back here about 10 years ago.
I am a proud Houstonian.
What initially drew me to Baylor was actually my interview day here. You know, you get the best of all worlds, right? You get to train at a private institution like St. Luke's, and then work with veterans at the VA, and then come and work with indigent population here at Bentop, which is where I work now.
I have been at Baylor for a long time because I was a Baylor medical student and a Baylor resident, and after that I liked it so much that I decided to stay on the faculty.
I went to school here and also did my residency here, and this is where I met my husband.
So I actually discovered Baylor as one of the premier institutions when I was applying for residency programs straight out of med school in Pakistan.
I was a medical student and resident at Baylor College of Medicine, and I was away for a few years but couldn't wait to get back.
Here's where the people were that I wanted to work with. Here's where the patients were that I wanted to work with. Here's where the consultants were that love medicine, they love evidence-based medicine, and they love treating patients right.
It has probably one of the best med-peds programs in the country, so that's what initially drew me here. I think it has a great variety of patient populations that we serve. You know, St. Luke's, Texas Children's, Bentop, MD Anderson.
Mentoring is such a critical aspect to why I chose an academic career.
I came to Baylor because I love the diversity of Houston, I love the institution, and I love Bentop. It's a very, very, very diverse patient population, and so that's something that I have fallen in love with.
So I came down to Houston because my now husband was a co-resident with me up in Boston, and we ended up down here together because his family's here. But once I knew I was looking in the Houston area, it was pretty much Baylor or bust. I had heard a lot about it actually at residency at MGH. There's a nice kind of cross back and forth between students and faculty. So I had heard a lot about it, met people who trained here, who had been faculty here, and specifically knew Bentop was a really kind of great place to practice clinical care, learn about medicine, learn about the social factors of medicine, and that was a big draw, knowing it was one of Baylor's big teaching hospitals.
I love Baylor for the diversity in the patient population, and also the training itself is top tier, and that's how I became the doctor who I am today.
Very cool faculty at the cutting edge of research, as well as some superb clinicians that you work with, and you sort of become part of that family and stay.
My colleagues.
Good culture, community,
Collaboration,
camaraderie, and
My interaction with the house staff and my fellows is awesome here.
sort of taking care of each other, having a good time, but also pursuing the excellence in our work.
Here's where the hospitalists were that cared about evidence-based medicine. They cared about each other. They liked to go out after work. We can't do that anymore, so we just do Zooms on Friday night at the worst possible time. But I still love my colleagues.
And you can't really ask for a better group of colleagues than that.